Thank you so much, Miranda and Elisa, for inviting me. And I'm really honored to follow that really thoughtful and touching presentation from Dr. Friedman. Dr. Friedman, sharing that journey must not have been easy today. I hope it was also healing because all the families here and the professionals here were very touched. So, if you're a parent or a person with ALD, you may already be quite familiar with the ways in which ALD can impact psychological health. And if you're a clinician, you may have observed some of your patients and their families struggling to manage the cognitive and mental health effects of ALD. Last year at this conference, as Miranda mentioned, we had the family panel that highlighted these effects, with families on the panel describing their experiences after having received a diagnosis of ALD or in parenting a child after treatment for cerebral ALD. So in the next 20 minutes or so, Dr. Isaia and I would like to provide some updates about projects, both within our research group and in tandem with ALD Alliance, to advance knowledge and support for the psychological impact of ALD. These projects address three gaps that have been identified in our conversations with clinicians, researchers, families, and other stakeholders. The first is a need to adequately capture and measure the neurocognitive, mental health, and quality of life outcomes in our research studies. And I'm kind of using psychological outcomes as an umbrella term here for all of these different components of health, of kind of neurocognitive and mental health. And I'll talk about a couple of recent studies from the University of Minnesota that highlight the importance of these types of measures in understanding the long-term impact of ALD, and especially of treatment for cerebral ALD. And the second gap is the need for a synthesis of existing knowledge in this area. And so to address this need, one of our current initiatives is to conduct a comprehensive review of how patients' cognitive and mental health and family functioning are impacted by ALD. And so this research effort is ongoing, and I'm only going to briefly touch on the methods and the timeline for this review. And the third need is to have more accessible knowledge and information about ALD and about coping with ALD that could empower families to get the help they need and feel connected and supported, and try to help to answer some of those questions that have come up in your minds as you're processing Dr. Friedman's presentation and some of the other presentations today. And I appreciated also that he mentioned the importance of kind of connecting with each other and with communities, in addition to having resources available. And so starting with the first gap, which is related to the need for more robust measurement tools in our research studies. So the bulk of our ALD research focuses on kind of the basic mechanisms of ALD, on diagnostic questions, on improving treatment. And these methods have led to such enormous strides in care for ALD over the past few decades. One idea I'd like to emphasize is that I think it's very important that clinical studies include strong methods to quantify patient and family functioning after diagnosis, as families are coping with ALD and after treatment. Improving psychological measurement can help us to better understand kind of the full range of experience of patients and families. It can help us to better predict treatment response and better measure the effectiveness of our treatments, especially for cerebral ALD, but also for other phenotypes that can impact mental health and quality of life. I'd like to give a few examples of ways in which psychological measurement has helped us to better understand cerebral ALD. And these examples are derived from our outcome studies of patients who underwent treatment for cerebral ALD with hematopoietic stem cell transplantation. First, studies using neuropsychological measures have helped to highlight and reinforce the significance of detecting cerebral ALD early. And the importance of early treatment is something that's been known for decades, that patients treated early respond better, but it hasn't been until the last few years that we've understood exactly how early treatment must occur to fully preserve cognitive function. So this graph is from a study where we looked at neurocognitive outcomes of patients with quite small lesions at the time of treatment, with a less score or MRI severity score of 5 or less. And we looked at outcomes at a median of 2 years after transplant. What we found in this study was a clear advantage for patients who were treated with the very smallest lesions. This graph is showing outcomes on a measure of processing speed, which is kind of like mental efficiency, your ability to think quickly and process information rapidly. And that's on the y-axis, and the MRI severity score defined by the less score is shown across the bottom. Here, whereas most patients with a less score of 2 or less scored at the average range on this test of processing speed at 2 years after treatment, patients with slightly more advanced lesions were at greater risk for slower cognitive processing. In using other psychological measures, we found that they were also more likely to have challenges with things like fine motor dexterity, and more likely to have psychiatric symptoms such as inattention and hyperactive behaviors after treatment. And so this study reinforced kind of the importance of newborn screening, of course, of robust MRI surveillance, and of efficiently moving from identification of cerebral ALD to treatment. Neuropsychological measures are not only useful for measuring outcomes after treatment, but also for predicting response to treatment. So in this 2018 study, we explored which patients with cerebral ALD had the best adaptive outcomes after transplant. And so these were patients that were identified fairly early, and also those identified later on. And the adaptive functioning measure that we used includes things like communication, social participation, ability to participate in activities of daily living, independently, like dressing, bathing, and feeding oneself. So things that are very important to impact quality of life. And the green circles here depict patients with age-appropriate adaptive functioning at their most recent follow-up after treatment, whereas the orange and red markers depict more impaired functioning. And what the study found was that a neuropsychological measure of fine motor dexterity at the time of transplant was the strongest predictor of adaptive functioning. That's on the y-axis. And the second best predictor was the extent of MRI severity, defined by the less score, on the x-axis. And so together, these two pieces of information, how many brain structures were impacted by disease and how the patient performed on this measure of fine motor dexterity prior to treatment, they fairly reliably predicted the level of independent adaptive functioning in daily life. And so the psychological measurement here can be helpful for prognostic counseling so that families can better understand the level of support that might be needed to care for a child after treatment. And a final example of the role of psychological measurement in understanding cerebral ALD comes from our most recent study that compared outcomes of patients who differed based on the location of the demyelinating lesion. And so this was a study that was led by my colleague, Ashish Gupta. As we know, for the vast majority of patients who develop cerebral ALD, the lesion typically begins in the posterior region of the brain, starting in the corpus callosum and then moving into the parietal occipital lobe. That's about 80% of patients with cerebral ALD. For about 15%, the lesion starts in the corpus callosum and then spreads into frontal white matter. And this figure depicts pre and post-transplant scans from a patient with frontal involvement at the top, A, and one with parietal occipital involvement at the bottom, B. Because ALD is so rare and it's been very hard to conduct large-scale studies to compare outcomes of patients with these different MRI patterns, it has been very difficult to conduct these studies, but some publications have hinted that survival and that risk for disease progression may be less favorable for patients with the frontal pattern. So in our study, we compared 7 patients with frontal lesions matched on MRI severity score to 7 patients with parietal occipital lesions. And what we found was that survival and MRI disease progression and transplant outcomes were broadly similar across these two groups. All of the patients in this comparison were identified fairly early in the disease course with a LES score of under 10. However, when we examine the results using our psychological measures, a little bit different picture emerged. So here, the median interquartile range and range of scores from scales of neurocognitive function are depicted with box plots, with the red boxes showing scores from the frontal lesion group and the blue box showing scores for the parietal occipital lesion group in terms of how they performed on neuropsychological testing after treatment. And these scores were derived from about 1 to 2 years after transplant. So broadly speaking, the cognitive testing results were pretty similar between the groups, with only a higher risk for problems in working memory in the patients with frontal lesions. So in this kind of test, a higher score indicates better performance relative to other kids their age. So working memory involves the ability to kind of attend to information, retain it in mind, and then do something with it, kind of like remembering a phone number or what the teacher just asked you to do for your assignment or the set of chores that you need to get done. And so patients with frontal lesions were more likely to have severe challenges with working memory. When it came to psychiatric outcomes, the differences were bigger yet. So we found that by follow-up after transplant, patients who had frontal lesions were much more likely to experience psychiatric symptoms. So each line here depicts a patient's score on a caregiver observational measure of behavioral symptoms. And the patients with frontal variants were more likely to have clinically significant problems with inattention, hyperactivity, and impulsive behaviors. And higher scores on these scales indicate more severe symptoms. And so the patients with frontal disease also had a higher tendency to show atypical behaviors, things like making inappropriate comments, tangential speech, destructive behaviors like ripping pages out of books, poor social boundaries, things like looking through strangers' belongings in a waiting room. And they really showed a higher symptom burden across several aspects of psychopathology. At 1 to 2 years out from treatment, patients with frontal lesions were also more likely to have been prescribed medication for psychiatric symptoms. So 6 out of 7 patients that we followed were prescribed from the frontal group were prescribed stimulant medications for kind of these inattentive and hyperactive and impulsive symptoms, as compared to only 1 of the patients with parietal occipital disease. So to a neuropsychologist, these findings may not be, too surprising, since we've seen from other patient populations and from basic research how important the frontal lobes of the brain are for regulation of attention and behavior. But by being able to quantify the differences in psychiatric outcomes in different ALD patient groups, I think we can be more prepared to identify, first, that patients with cerebral ALD may require school and social and behavioral supports after treatment. And 2, that certain patients, like those with more extensive lesions or with frontal lesions, are likely to require a higher level of care, such as working with a psychiatrist, a mental health case manager, or a mental health therapist. So to summarize the last section, there's a need for robust measurement of psychological outcomes, not only to identify areas of need in the ALD community, but also to inform treatment approaches and provide counseling and resources to families. In the next section, I'd like to take a few minutes to talk about our current review of existing knowledge on the psychological impact of ALD. As far as we're aware, there haven't been any recent studies that have pulled together or synthesized what's known about neurocognitive and mental health effects, and we're delighted to have received some support through ALD Alliance to pursue this type of literature review. Dr. Isaia and I, along with other colleagues, have been working toward a goal to comprehensively pull together the academic work in this area and provide advice for cross-disciplinary management. Since there's currently no cure for ALD that completely avoids potentially complex and life-impacting complications, it continues to be important for care teams to guide families in coping with the disease and its many consequences. We hope that by reviewing the literature, we can improve case conceptualization related to cognitive functioning and mental health in our patients, and then use these data to inform counseling and prognosis, and reveal additional gaps in the literature and directions for future research. So our initial step here was to search the literature to find all articles relevant to understanding the neuropsychological and mental health impact on individuals with ALD and their families across the lifespan. So this search strategy was used to identify studies that might pertain to this topic. After conducting this search, we narrowed the scope of the review to fit 4 main criteria. So we're looking for manuscripts that were peer-reviewed and that were empirical studies, meaning they examine some aspect of clinical functioning in a patient cohort. And we included only kind of group studies, so group studies that contained at least 3 patients with ALD or family members as participants. And then we included studies if they measured some aspect of cognitive or behavioral or mental health functioning or quality of life. So with these first 2 steps completed, we're now focusing on the synthesis of the literature and then eventually submission for publication in 2022. And we hope to share some of the results and insights, best practices, future directions derived from this effort at future conferences. So moving along to the last portion of our collaborative efforts, I'd like to turn it over to Dr. Ashley Isaia, who will be sharing updates related to the work that we're doing with ALD Alliance and professionals and families in the community. Many of you on this at this conference today may be participating to create more accessible information and content that families might turn to for recognition of the psychological impact and additional support during their journey.
Great, thank you. So since last year's meeting, Dr. Pierpont and I have been working closely with Elisa and Miranda at ALD Alliance, really to establish a set of tools that will focus on whole family care for those navigating the ALD journey. And together, we've created a work group, and this work group has been filled with parents, as Dr. Pierpont just mentioned, also members of other ALD organizations and healthcare professionals at ALD centers. Our goal here is to create a webpage that provides accessible, accurate, and meaningful content that addresses the psychological impact of ALD on families. And we really aim to offer a variety of resources for families. So this, would include things like educational assistance, financial assistance, social support, and then tools to meet families' mental health needs. Today, I'm really excited to share information about our progress with the development of these resources. Our goal is to create material relevant to families at different stages of their ALD journey, whether that's diagnosis, treatment, or even after treatment. And we first started with the development of resources for families coping with a newborn screening diagnosis. Working collaboratively with parents who have experienced a diagnosis through newborn screening, we've created website content that focuses on the emotional impact of a newborn screening diagnosis for parents and caregivers. And we offer suggestions to support positive coping, including acknowledging that the many emotions that parents and caregivers may experience, and realizing that I can't tell if anyone has access to the slides. Rene, are those still available?
Are you guys still seeing the slides?
No.
Okay, I'm so sorry.
That's okay. We want to share some of the images for the website. So yes,
okay.
That works. Great, thank you. So on this page, as I mentioned, we offer suggestions to support positive coping, including acknowledging emotions that parents and caregivers may experience. In our next slide, which is going to show us another portion of the webpage, we highlight what an early diagnosis of ALD will mean for families in terms of both treatment for adrenal insufficiency, but also for monitoring for cerebral disease. This includes helpful tips for navigating things like your child's first few MRIs. So that includes videos provided by ALD Connect. And then we also have a link to the recommended monitoring guidelines developed by experts and ALD Alliance. And then I think, one of the great contributions that we also include in here is how to normalize having conversations with your children about ALD. So this is talking to siblings, talking to your child who has ALD, and what those conversations could look like. And we encourage you to have those early and often with your children. So we also supplement all of the content here from the text with videos, images, and quotes from parents that document their lived experiences of ALD related care. So I think it's a really nice personalized web page that hopefully people can find relevant content that can help guide them through navigating this journey. As we continue working on this content, we will be expanding information available on the website to address different topics and to touch on different aspects of ALD care. So we hope that you please stay tuned as we continue to develop information for the website. If you are interested in joining our work group, we are always looking for people to provide input or to contribute in any way. So if you would like to find out more information about what this entails or to sign up, you can feel free to contact Miranda at aldalliance.org. And I just want to add a special thank you to Miranda. She has put in so much hard work to get this website running and to have the content ready for this meeting. So we're really excited that this is now accessible, and you can visit the website. We include the link here, and we can probably add that in the chat as well. So feel free to browse that and look forward to adding more content for all of you as we make that available. Thank you.
Thank you, Dr. Isaia and Dr. Pierpont. It's been really great, the meetings that we've had this year and connecting with other families that want to help and see other families, get a grip on what they're dealing with. And it's just been a privilege. And we're really looking forward to diving into the next portion of this in 2022, which is heading into transplant. So we've been fortunate enough to connect with quite a few families. I think we had 5 or 6 on our last call. We already created kind of a worksheet. We're calling it what to pack, right? So it's not just what you pack to go to the hospital, but what you pack in your heart and your soul and the things you have to remind yourself of. So some families have returned that back to us already. So thank you for that. And if you'd like to join, please, by all means, reach out to me. I'd be happy to send that to you. And we are hoping to probably hold our next meeting in February. So just stay tuned for more information about that.